name is Aranza Torres Silva. I'm here on behalf of the Human Anatomy class. I am here presenting my Bio Expo project. It is focusing on a subtype of leukemia, which is called acute lymphoblastic leukemia. First, I would like to get to know you guys and what you guys know about cells. And so I would like to see what you guys know about these three cells. What do you guys think? Which one is a healthy cell? Which one is a red blood cell? And which one is a cancer cell? Do you guys have any guesses?
The healthy cell is A because it doesn't have duplicates around it. And we've known cancer to be that kind of disease where cells multiply.
I think B is cancer cell because it's bigger than the rest.
Okay, well, thanks for sharing out. Well, A is a healthy lymphoblast cell. This is a healthy lymphocyte because it is not abnormally small and the cytoplasm is not abnormal, such compared to a cancer cell, which is scant in its cytoplasm. Scant means irregular in size. The nucleus is, its outline is interrupting the cytoplasm, and then this is just the red blood cell. There's no nucleus in a mature red blood cell, and it's just a disc-like cell.
Question.
Yes?
So is the cytoplasm the background or the... Okay.
Now I would just like to explain some processes of stem cells. Stem cells develop in the bone marrow, and leukemia, it's a cancer that affects the blood and the bone marrow. And right here is just a picture of how stem cells begin in the bone marrow, soft tissue in the bone. And most mature cells, they develop from blasts, which you could tell by the lymphoid blast and the myeloid blast. And these are just types of white blood cells. And these other blasts are developed into red blood cells and platelets. Lymphocytes are main cells in the lymphatic system. They're found in the thymus, the spleen, the lymph nodes, the appendix, and are scattered around those areas.
To begin my presentation, I would like to present to you guys my objective, which is just to inform you guys about acute lymphoblastic leukemia, how it develops, how it affects the body of one that is diagnosed with it. So first, there's always a misconception of how leukemia is just one type of blood cancer. It is a type of blood cancer, but there's many subtypes to it. And leukemia is just a broad name for lots of subtypes. It is a type of blood cancer, but acute lymphoblastic leukemia is specific, and it develops mostly in just the lymphocytes, not like other leukemias which develop in, for example, monocytes, which is a different kind of white blood cell. It is also known as lymphocytic leukemia, and it affects both the blood and the bone marrow. Okay, so how does ALL, the abbreviation, develop? So the cause is unknown. It develops in the lymphocytes of the bone marrow. It is fatal within months if it is not treated. But what we do know is that leukemia cells, they develop and they don't mature fully. And so then they may not die at a proper time. They spread all around the body, and here on the next slide you will see some symptoms. So if you don't have the strength to do anything because your whole body consists of blood and your white blood cells defend your body, you develop a low blood cell count, and then that just makes you weak, and then you need to stay in the hospital for a long time. So these are just a couple of things, and over here it affects a person because the abnormal white blood cells, they don't work properly, and they may overcrowd the bone marrow, and the lower number of red blood cells and platelets affect you too, which develop the symptoms. And it not only makes your body weak, but it makes you weak emotionally, and that may cause the development of mental illnesses. So what are possible causes or risks? Well, causes are specifically unknown, but leukemia may develop after or during the process of having a disease or illness.
Some other things that can risk Getting leukemia is high exposures of chemicals, smoking was proven to be a risk factor, and genetic disorders like Down syndrome. It can be inherited, like if your family member had leukemia, it is a higher possibility that you can get it.
So what are the survival rates? Acute lymphoblastic leukemia is most common in toddlers, and it is known to be a malignancy to children.
Why might it be most common in toddlers?
Since a cause is not known, it is just probable that because of deficiencies and how children can develop diseases or illnesses easily, then compared to stronger, mature adults and their immune system, then it is more common in toddlers. And being in remission, which means not being treated for leukemia or a disease or illness. For leukemia, it's specifically after 10 years, then you're considered cured. Remission is almost 100%, which is incredible. And after that, it's just the cure rate is quite high.
How would you compare the fatality or the mortality rates of this disease to other forms of leukemia or general cancers?
I would compare this type of leukemia to other leukemias as this being focused on only one type of cell, which then is also acute. So it is not as slow advancing, because chronic leukemias, they are slow advancing, and sometimes you can't know when you have leukemia, and so sometimes you could get diagnosed with that chronic disease later in your life and when it's too late. And so the mortality rates here, which with acute leukemias, they are rapid growing, and so once you are a suspect of acute leukemias, then you could be cured faster than compared to a chronic leukemia.
So it's about being acute that differentiates this one.
Now on to some treatments. So some options depend on the person, the type of cell it affects, and what stage they're at. And some treatments can include stem cell transplants, chemotherapy, radiation therapy, and all this commonly lasts for 2 years.
What consistency is bone marrow?
What consistency?
Yeah.
It is not as liquidy as actual blood, mostly because they still contain their nucleus, and blood does not have a nucleus and only has the structures needed to carry oxygen, for example. So how is ALL different from chronic leukemias and acute leukemias? There are chronic and acute myeloid leukemias. They affect myeloid cells, which is a different type of white blood cell. And I also have chronic lymphocytic leukemia, which could also, you could call it chronic lymphoblastic leukemia, because acute lymphoblastic leukemia is also called acute lymphocytic leukemia. And those affect the specific lymphoid cells, lymphocytes. And there is also another chronic leukemia, which is called hairy cell leukemia, where it affects the bone marrow lymphocytes. Do you guys have any questions on these ones? Okay. So it depends on how quickly they develop and the types of white blood cells that are affected to then categorize the leukemia that you have. And there are also lymphomas, which are another blood cancer that affect lymphocytes, but mainly affect the lymph nodes. And the lymph nodes are glands of the lymphatic system. They can be visible, especially if they're inflamed. And they're prominent in the neck, the armpits, and the groin areas. And I mentioned this because the leukemias can be mistaken by lymphomas and vice versa. So I was just informing you guys about lymphomas too.
So I will be assessing you guys on information that you guys have taken in. You guys could talk together if you guys would like, or if you guys could just do it individually, that would be fine too.